Hello, everyone. Welcome to our second episode of Global Health Out Loud. I'm Dr. Sulzhan Bali, and with me is the magnificent Dr. Jessica Taaffe.
Well, thank you, Sulzhan. Did you say Dr. Jessica Taaffe? I hope so.
Yeah, I did say
Oh,
that.
sorry, I
I
missed
mean,
it.
we worked really hard to get those degrees, so
That is true. Use it.
absolutely. So, what are we talking about this week?
Well, this week we're going to be talking about how important microbial populations in the gut are to the development of children. And we're going to be talking about Zika virus myths and some updates from the recent HIV CROI conference that was happening in Boston this week.
That's fantastic. And we'll also be talking a little bit of a bad news about this interim findings of this Ebola study. So lots of fascinating things right here. Stay with us. So, Jessica, do you want to start with your story?
Yes, I will. So I came across this story last week. It came a little over a week ago, and I just thought it was really interesting. It's this study that came out in Science magazine showing that there are microbial populations that influence growth in children. So before I get into this new study, let me just give you some background. Now, microbes are responsible for helping with digestion, and there's been some research looking into microbial populations in malnourished and healthy children in studies in Malawi and Bangladesh. Now, although they were separate studies, both showed that malnourished children had an underdeveloped gut microbiome. And in the Bangladesh study, it correlated with how much weight they put on. So, this new study that came out in Science shows that it has results that go beyond the association between the microbial populations and malnourishment. What they show here is that microbes from undernourished children given to young mice resulted in impaired growth and development. But if you give those same mice specific microbes that are associated with age and growth, this turns around the growth impairment, and then it gets better, and they actually start developing better. So yeah, that I just thought it was really fascinating.
That is indeed fascinating. I mean, and in fact, really important to global health. Malnutrition, according to WHO, accounts for more than one third of child deaths. And although even it's rarely listed as a direct cause, so looking at microbial populations and understanding them may, offer a solution. Maybe figuring out why kids have these stunted or different microbial populations.
Mhm. Absolutely. Well, and here's the thing is we actually don't know why malnourished children have these stunted microbial populations. So that's what people are looking to find out about. There are a number of theories from, exposure to antibiotics, poor diet, gut diseases. There's a lot of things going around that people want to investigate.
So, Jessica, let me ask you this. What about probiotics? All this while, I have believed in the philosophy of stay calm and eat your yogurt. So, probiotics, does that not work or?
Well, first of all, I think that's your own philosophy right there. That I've never heard that before, but it doesn't sound like a bad one, so I'll go with that. But but in all honesty, probiotics actually have been proposed as a solution. That you're just kind of giving more healthy bacteria to people. To have healthier bacteria in your system. But the problem is that these microbes that they have in the yogurt and stuff, they actually don't establish themselves and grow well enough in the gut. So what the difference was with the microbes that did result in the growth improvements in the study in the growth impaired mice, they actually colonized and really quickly, and they established themselves well. There are also other things that people are looking into in terms of solutions, right? You're thinking probiotics is a solution, but it's not just about maybe giving them the right bacteria. It's about nourishing the right bacteria. And people are trying to figure out, well, how do we do that? That's another area of investigation.
So, what about breast milk? We know that breast milk is really important in infant and child development. Is there any association there?
Well, actually, breast milk is really important for bacterial populations in children. And interestingly, it's been found that in Malawian mothers of severely stunted children, they actually have lower levels of important sugars that those bacteria in infants need. But if you add in those sugars that restore a function to burn fat for energy when sugar isn't available, then it's that like this the problem is then ameliorated, and mice can grow better.
Got it. Got it. Like fascinating. I mean,
Mm-hmm.
definitely, we'll put the links in the show notes. So definitely check out the study. So my story, Jessica, is on Zika myths. Anytime there's a new outbreak or an exotic outbreak, there's an increase in demand for information, but a vacuum of accurate information, which leads to a lot of myths and misinformation. We saw this with Ebola, and now we're seeing this with Zika. So for my piece, I'm going to take this space to discuss some outrageous myths that have recently been officially debunked by WHO and some innovative measures for Zika control. It's time to quell the rumor mill, so let's take note. So, according to WHO, there is no evidence that Zika outbreak and the unusual increase in microcephaly cases in Brazil is linked at all to the recent release of genetically modified mosquitoes in Brazil. These mosquitoes are very interesting. So they're termed as friendly Aedes. Aedes aegypti, as we know, is the vector for Zika as well as dengue and other diseases. So these mosquitoes are genetically modified, so their offsprings don't live. But the catch is they need to be released year after year and are costly at $7 per year per person to prevent infection. So that is the only catch there, but definitely no link between Zika, microcephaly, and GM mosquitoes.
Yeah, got it. So what else have you heard? Is there anything else out there?
Absolutely. The other things I've heard is like vaccines. Let me quote WHO when I say this. Vaccines do not cause microcephaly. There's an extensive review of literature that was published in 2014 that found no evidence that any vaccine administered during pregnancy resulted in any kinds of birth defects. The other thing that I've heard and that WHO debunked officially is the link between larvicides such as proxyfen. I'm sure I killed that name, but any larvicides that are recommended by WHO are, to reduce mosquito populations. They do not cause microcephaly either. And, this is after review of immense toxicology data by not only WHO, EU, as well as the US Environment Protection Agency. There is no link there. In fact, they're a great tool to kill mosquitoes at the larval stage, where you have water in open containers.
Mm-hmm.
The last but not the least interesting myth debunked by WHO is that bacteria used to control the male mosquito population are not spreading Zika or microcephaly either. I know, right?
Oh no. Well, go on. Tell them.
So bacteria such as Wolbachia bacteria are basically bacteria that are found in 60% of common insects, including butterflies and fruit flies, that are being used to control Zika. Basically, mosquitoes infected with this bacteria are unable to transmit viruses for some reason. So, these mosquitoes carrying Wolbachia have been released in several places, and they've been proved to be effective in Australia, Brazil, Indonesia, Vietnam to control dengue. So another great innovative measure to control Zika, but all the myths there is no relation. There are great methods to control mosquito vectors, but no link with causing microcephaly. So there.
Got it. Well, let's end our episode with some good news and some bad news. And I guess we'll go with the good news first. You good with that?
Yes. Let's do the optimistic first.
Okay, awesome. All right. Well, the big scientific conference, the big scientific HIV conference, CROI, which stands for the Conference on Retroviruses and Opportunistic Infections, was this week in Boston. And one of the big highlights of this conference was the release of results from 2 large studies of a vaginal ring that releases antiretroviral drugs for HIV prevention. Both studies showed efficacy in preventing HIV in women between the ages of 18 to 45 years old, living in several countries in sub-Saharan Africa. And the efficacy from these studies in terms of preventing HIV infection was between 27 and 31%. This is a huge win for the field of HIV prevention. And the reason why is that women are among the most at risk for HIV infection in sub-Saharan Africa. And it's due to a number of reasons like gender inequality, gender-based violence, and stigma. So because of these factors, using condoms or insisting on their use is not always possible. So having this other option that is completely in control of the woman, that's discreet, and still prevents HIV infection is a fantastic way to empower women to protect themselves from HIV.
Absolutely. I mean, a great study, and I completely agree. It's a great tool for women, especially because the disease is linked with gender-based violence and controlled by men a lot. Looks like I will be the bearer of the bad news for the week. Yeah. So I'll be talking about Ebola. There is an ongoing study with 82 Ebola survivors in Liberia that's been going on. And what they have been finding is that the symptoms, the brain and neurological symptoms of Ebola viral disease actually last longer, even more than 6 months after infection. And these symptoms include headache, memory loss, depression, abnormal eye movement, etc. But so it's kind of like for the first time we're learning of the extended after effects of Ebola. And this study is crucial, especially because there's 17,000 survivors of Ebola in West Africa. And most of these survivors that they've seen in the study have had health issues and neurological damage of some kind. So definitely a study to watch out for. They released their complete findings in April. So a big thing there.
Yeah, I mean, I caught that too, and I'm glad you brought that up because I actually didn't have a chance to read the story, but I, caught bits of it here and there, and that's unfortunate, as if, like, having Ebola wasn't bad enough, that they have all these lasting effects that's, well, we'll just see what happens with it and keep an eye out.
Absolutely. And since we're on the topic of Ebola, and today is the night we're recording is actually the Oscar night. So a short shout out to a short documentary called Body Team 12 by David Darg and Brian Mooser. It's a contender for the best Oscar short documentary, and it's a documentary, incidentally, on Ebola. It's a documentary based on Garmai Sumo, the only female member of a body disposal team of 12 that is tasked with collecting corpses of Ebola and cremating them. So apparently it's been doing really well. I haven't had a chance to watch it, but it's totally on my agenda tonight.
Interesting. I didn't even know about that. You surprise me with things every day, Sulzhan. I'm really pleased. Like that's exciting to hear about that. I didn't know that was a contender, and what a great story. Of course, obviously from the female perspective of doing a really hard job, and probably one of those untold stories. So, very cool. We'll have to see how that does in the awards ceremony.
Absolutely, I'm keeping my fingers crossed.
Awesome. Well, there you go. Global health in media, or like in the film business. That's right. And it's not like the Contagion outbreak. Like it's a documentary. Well, it's a story worth telling.
Absolutely, completely agree. So looks like that's all we have for you guys this time. Stay tuned for other interesting stories that Jess and I come up with. We'll keep surprising you.
That's right. All the best stories for everybody.
Absolutely. This is all from us at Global Health Out Loud. We'll see you next time.
Bye.